So the most common side effect of an implant is irregular bleeding, and that can be anything from no period at all to prolonged spotting or anywhere in between there. So some women may not have a period for 6 months and then may have spotting for 3 weeks and then no bleeding again for 2 months and then spotting for 2 weeks. Some women literally don't have a period at all after placement, and they may not have a period for the full 3 years of the implant. Some women have spotting for 3 months and then may not have a period after that. So irregular bleeding is the #1 side effect or complaint that we get about the implant. And if I always tell my patients, if you have any questions about if your period or bleeding is irregular, you can always ask me. My answer will probably be yes, that's pretty normal. There's a small percentage of women, typically less than 10%, who will have some side effects, including headaches, nausea, breast tenderness, or any other issues in the first week of having the implant placed. And that's usually because the medication goes up in your system and then comes down and plateaus out. So typically those side effects will go away in the first week. If they don't and they persist, that would be something you would want to talk to your provider about. You can be anywhere in your cycle, in your menstrual cycle when you get the implant placed. You don't need to be on your period or not on your period. That doesn't matter at all. The implant does not protect you against sexually transmitted infections, so of course we still recommend that you use condoms or some barrier device when you're having intercourse, and that you're tested annually or every time you change partners. The implant will not affect your fertility at all. You will have the same fertility after the implant is removed as you would have had at that age as well. There is a very small risk of pregnancy when you have the implant. That's less than 1%. However, because of the probability of having that irregular bleeding, you may not realize if you do become pregnant. And so if you have a new onset of nausea or breast tenderness or fatigue or any other concerning things, then you should take a pregnancy test at home. And if it's positive, you need to come in right away. There is a small increased risk of ectopic pregnancy in women who have the implant and do get pregnant. And an ectopic pregnancy is when you're pregnant not within the uterus, and so typically that's in